Breaking tonight, union workers, including nurses at Women and Infants Hospital, say they plan to walk off the job on December 12th if they can't come to a contract agreement in the next 2 weeks with Care New England. Both sides have been in negotiations for months over wages and benefits.
And they spent the past 3 days voting to authorize a strike. About an hour ago, they did just that. If it all falls apart, NBC 10's Temi Topa Adelea live in Providence now with the latest news. Temi?
Yeah, Gina Patrice, like you just said, Women and Infants says that they are disappointed to learn that union workers intend on walking out on December 12th if both sides cannot come to an agreement on wages and benefits. They say that they will continue to negotiate over the next few weeks, hoping to avoid a walkout, but parents say that they're still concerned. Workers at Women and Infants telling their employer late this afternoon they plan to walk off the job on December 12th if they can't come to an agreement on wages and benefits. The news shaking up families who fear expecting parents will suffer as a result.
Be concerned about, the care that I'm going to receive, the care that especially my child's going to receive, if they're going to have, people who are not expertise in, the labor and delivery part of it. They're probably taking nurses who that's not their specialty area. I'd be concerned about that.
I can't even imagine having to do that, knowing that I was going into a hospital where they would be understaffed, and I think that would pose immediate risks to patient safety.
During the public, it still plans to deliver excellent patient care if a strike does happen in 2 weeks. A statement from the hospital tonight saying, in part, the hospital has contracted with a highly respected national firm to provide nursing, other direct care, and support services over the course of a work stoppage. These professionals have all the credentials and certifications necessary to do an excellent job for the people of Rhode Island. The hospital says it plans to continue negotiations over the next 2 weeks and hopes to avoid a walkout. Meantime, mothers tell expecting parents to hang in there and maybe look for other options.
Stay strong and just know that they are going to do the best that they can for you and your child.
Listen to the nurses. I have a lot of friends who are nurses, and I know that they struggle with staffing issues, being overworked. It creates dangerous situations for them and their patients. I think that they really need to be listened to.
Now, we've got lots of information here for you. Hospital leaders say that doctors will continue seeing patients for scheduled in and outpatient care. That includes prenatal visits, fertility care, OBGYN checkups, mammograms, and other screenings. The emergency department, neonatal ICU, and labor and delivery unit will remain open. And the State Department of Health also will be reviewing the hospital's plans to operate safely in the event of that strike. Live in Providence, Temi Adelea, NBC 10 News.